So today I'm going to talk about normal sleep patterns in childhood and adolescence. And the reason we're talking about that today is because sleep demonstrates very dramatic changes over the first 2 decades of life. And we often get a lot of questions from parents about what is normal and what is more indicative of a future problem. So today I'm going to focus on common problems and also averages as far as duration of sleep and what you can expect at each stage as your child grows up. So today I'm going to divide childhood and adolescence into 5 different areas. We'll talk about the first 2 months of life, or early infancy. Then we'll talk about later infancy up to 1 year of age. We'll then cover the toddler years from 1 to 3, and then early childhood and school-age children, ages 4 to about puberty, and then adolescence, which is puberty on. For each one, as I mentioned, we'll cover the normal sleep needs in each of those ages, and we'll also cover common problems that parents can expect as they watch their child grow up. So the first stage, newborn, leading up to about 2 months of age, is characterized by very erratic sleep patterns. Children at this age will often sleep throughout the day and the night, but the total duration of sleep is approximately 13 to 14 hours in a 24-hour period. The child's main job is to consolidate sleep to more nighttime, so what you see at the beginning of life may be slightly different than at 2 months. One of the common concerns that parents talk about is that when they watch their newborn sleep, they'll often see grimacing and twitching at the early stage of sleep. Some parents question whether that is indicative of very restless sleep that doesn't have very good quality, or if their child is actually experiencing seizures. However, that early stage of sleep, when you see the grimaces and the twitching, that is called the active phase of sleep. And it just is a normal part of newborn's development. But of course, if you have further concerns, you should always consult with your pediatrician. The other thing that parents worry about is whether or not to feed their child when they cry in the middle of the night. And up until the age of 2 to even 3 months, when children cry in the middle of the night, it's usually because they are hungry, and you should feed them because they are physiologically unable to sustain that nutrition throughout the night. So feeding your child and addressing their needs at that early stage of life is not a problem. However, at the end of the 2 to 3 months, you should consult with your pediatrician about beginning to put your child in the crib drowsy but awake. This helps teach them the ability to soothe themselves to sleep and would then prevent further problems later on down the road. In this newborn stage, the most important thing about sleep is to keep them safe. And the #1 principle is always to lay your child on their back to go to sleep. This helps prevent sudden infant death syndrome and is recommended by the American Academy of Pediatrics. In addition, you want to make sure the crib is free from all materials like blankets or pillows or even stuffed toys. And if you can, just put your child in a sleeper to sleep so that they don't have any risk of suffocation with blankets or other materials in the crib. The other thing, as I mentioned earlier, is that a child's whole goal in that first 2 months of life is to begin to have more normal sleep patterns where they sleep predominantly through the night. One of the ways you can set the stage for this is to expose them to bright light in the morning and dimmer lights at night. That helps the child's brain recognize when to go to sleep and when to stay awake. Finally, at this stage, in the first 2 months, some red flags that should warrant consultation with your pediatrician is if the child is completely inconsolable, even after a dry diaper and being fed. If they remain inconsolable, then you should talk with your pediatrician because this can be a subtle sign of acid reflux in infancy or intolerance to formula. After the 2-month mark, when children are placed in their crib drowsy but awake, you start to see some very dramatic changes in their sleep patterns. The average duration of sleep for children from 3 months to 1 year is 9 to 10 hours at night, plus 3 to 4 hours of naps during the day. But a 3-month-old and a 12-month-old may nap very differently. The 3-month-old may still have several naps per day, but the 1-year-old may be down to 1 or 2 naps per day. In addition, the frequency of the naps and the duration of naps can vary widely from child to child. However, that total duration of sleep in a 24-hour period is relatively constant. The common worries and concerns that parents express to us at this age is, one, separation anxiety. As the children get into later infancy, they begin to understand that anxiety that comes with separation. And we know that even great sleepers wake up 4 to 6 times per night. Those brief arousals in great sleepers just result in them turning over and going back to sleep. However, for the child experiencing separation anxiety, even if they were sleeping through the night for the previous couple months, they may actually wake up and start crying because they're feeling scared that their parents aren't there. At that time, it's best to walk into their room, console them back to sleep, rub their back, but keep them in the crib as much as possible. In addition, parents often report that they see their child engage in head banging or body rocking behavior at this age. This again is very common and usually does not result in any injury. However, if the child is very vigorously banging their head or to the point of kind of rocking the crib, that is something you should talk with your pediatrician further about as far as safety concerns. Moving into toddlerhood, or children ages 1 to 3, the average duration of sleep begins to shorten and it begins to focus more on nighttime sleep. The average amount of sleep that a toddler needs at night is anywhere from 9 to 11 hours, and then they also take a nap of anywhere from 1 to 3 hours. That 9 to 11 hours is generally consolidated and they should be sleeping through the night. However, we know at this age they begin to talk more and act out more because it's called the terrible twos for a reason, and bedtime problems become a bigger issue. As an example, a child may not want to stay in their crib, so they jump out of it. Or they start to become much more engaging and running around just prior to bed in order to delay bedtime. That's because their brains are growing and learning, and they want as much time as possible outside of sleep. However, it's critical to get kids the 9 to 11 hours at night plus their nap and keep them on as much of a routine as possible. In addition, one of the other questions we get at this age are whether parents should transition a child to a big kid bed. And that is usually prompted by that child launching themselves out of the crib and parents being concerned about safety. While at this age it is normal to transition to a big kid bed, there is some variability as far as when the child should go into that bed. In general, we always say that if the transition does not go well to a big kid bed, that it's okay to put them back in the crib. And there are safety precautions you can take with the crib to ensure that your child does not get hurt. From ages 3 through puberty, children will experience some variability, but in general, they usually need about 9 to 10 hours of sleep per night. In early childhood, napping is still common, with the majority of 3-year-olds taking a nap. However, by the age of 5, most kids at this age do not take a nap, and we actually consider daytime sleepiness in this age a red flag for a further problem. So some common worries and concerns include the bedtime problems, and this can stem both from opposition to bedtime or wanting to delay the inevitable so they can have more fun, as well as anxiety. Children at this age and through school age begin to understand some realistic fears, such as break-ins or burglars, and they may have such significant fears that it causes them not to be able to settle to sleep. In addition, we often see that children who sleepwalk or have night terrors will have their age of onset at around this age, where they first are seen to sleepwalk or have sleep terrors. Sleepwalking is usually something that doesn't result in injury. However, there are precautions you should take to make sure that your child can't exit the house or go down a stairwell. Sleep terrors usually occur in the first third of the night and are much, much more scary to the parents than the child. The child has little to no recollection of the sleep terror as it arouses out of a state of sleep where they're essentially unconscious. The sleep terrors can look very frightening, and the best thing you can do is ensure that the child is safe and to minimally intrude, because if you try to waken the child during a sleep terror, it will often extend the period of the sleep terror. The other concerns that often come up in this age are nightmares. And children who have nightmares tend to have them in the later parts of the night, and they're different from sleep terrors because the child can recall the event, and they often seek out help from the parents by going into their room and waking up their parents. It can also result in the child having difficulty going to bed the next night because they want to avoid having the nightmare. The best thing you can do for your child who has a nightmare is to talk it through the next day. And one of the other strategies we often use is have the child make up a funny ending to the nightmare to allow them to take control over that dream, and it can also set the stage for fewer problems with nightmares later on. Finally, one of the other issues that's common in this age group that we get a lot of questions about is bedwetting. And up until the age of 8, we generally do not intervene strongly on bedwetting concerns because it's considered fairly normal. However, after the age of 8, if the bedwetting persists or it limits your child wanting to go to sleepovers or overnight camps, please consult your pediatrician because there are some strategies that can help. So the last time period that I'm going to talk about is adolescence. And adolescence is captured by the start of puberty. So if you look at a bunch of middle schoolers, there's going to be some variability because when people have the onset of puberty, it varies dramatically. The one thing we know about adolescents is their sleep needs do not change dramatically from childhood. They still need approximately 9 to 9 hours and 15 minutes of sleep per night. However, unfortunately, it's very rare for teenagers to get this amount of sleep, leading to almost chronic sleep deprivation in many of our teenagers. There are two main issues driving this. One is there's a normal fluctuation in hormones at the onset of puberty, and this can cause a slightly delayed sleep phase in which our teenagers become more night owls, and their bedtimes often drift into later times. This results in them having a burst of energy at a time when maybe 2-3 years ago they were going to sleep. In addition, teenagers have increased societal demands, academically, athletically, and socially, and this can often result in them trying to cram in a lot of different activities in a shortened day. Both of these factors contribute to a teenager often getting only maybe 6 or 7 hours of sleep per night, rather than the 9 that's recommended. So in this last part of the talk, I want to focus on preventing problems, whether the child is a newborn or a teenager. And the number one thing that we often talk about to parents is that routines are extraordinarily helpful in helping a child go to sleep and stay to sleep, and that consistency is key. And while life will throw curveballs at you and your child may become ill or summer vacation hits, it's still critical to remain consistent with bedtime routines, whether that's the sequence of taking a shower and then reading and then going into bed, or whatever your family deems as their routine. The second thing is that our brains are very sensitive to light exposure, and that helps us set our sleep patterns. One of the things that you can do, again, both from newborns on, is to have brighter light in the morning and dimmer lights at night. Whether this means for your toddler taking them for a walk in the morning, or for your teenager throwing open the shades when you try to wake them up in the morning, this can help get people up and moving. And on the same token, dimmer lights at night help tell the brain that it's time to go to sleep. So minimizing exposure to computer screens or bright lights when doing homework can actually help the teenager or child fall asleep more easily. The third thing is that it's critical for parents to view sleep as an opportunity to teach their child to do a healthy habit independently. So right from the beginning, at the age of 2 or 3 months, when you put your child to bed drowsy but awake, you're giving them the opportunity to learn the skills to independently initiate sleep. In addition, setting rules and limits for toddlers and children to make sure that they stay in bed and that the routines that led up to bedtime are comforting and soothing helps make sure that the child feels that sleep is an important and healthy habit to develop. And finally, for teenagers, setting limits on whether or not they can bring their cell phones into their room or have a laptop as they go to sleep. Make it inherent to them that sleep is an important healthy habit and that you're encouraging them to develop that over time. Finally, as children get older, parents often miss sleep problems that the children themselves report. Checking in with them every once in a while and ask how they're sleeping, if they're falling asleep easily, if they're staying asleep, if they feel rested during the day, can help you stay tuned into their sleep patterns and make sure that you can consult with someone if you feel that things are a problem. Finally, if there are issues that come up that concern you about your child's sleep, it's important to consult with a pediatrician right away. Sleep can affect learning and memory, and as kids get older, their attention and focus when they're driving or at work. Some signs that you should consult with your pediatrician include children being sleepy during the day when they haven't taken naps for a while, or teenagers not being able to sustain wakefulness during class. In addition, if you hear them talk about waking up with a headache or a sore throat, or if you hear snoring or loud mouth breathing during the night, you should talk with your child's doctor to see if any concerns should be looked into. Finally, if your child is very oppositional at bedtime or they cannot fall asleep without a parent's presence, that's worth talking with your child's doctor to see if there are simple strategies to get your child back on track to learning how to sleep independently.